you ever felt that sharp, pulsing pain that seems to take over your entire head, making even the faintest sound or light unbearable? That, my friends, could be a migraine, one of the most misunderstood and underestimated neurological conditions in the world. Migraines are not just headaches, they are complex attacks that can completely disrupt a person's ability to live, work, and even think clearly. So today, let's dive deep into what a migraine truly is, why it happens, what symptoms warn us, and how it can be managed or treated effectively. A migraine is a neurological disorder that causes intense, throbbing pain, usually on one side of the head. But it's far more than pain. It's a wave of electrical and chemical changes inside the brain that affect how the nerves and blood vessels communicate. Imagine your brain being overwhelmed by signals that it can't filter properly. That's what's happening during a migraine. It's like your brain's alarm system has gone off for no real reason. Now let's talk about the causes, because understanding the root helps in controlling it. Migraines are triggered by a combination of genetic, environmental, and lifestyle factors. If one or both of your parents had migraines, there's a high chance you might experience them too. But triggers play a huge role. Common triggers include stress, lack of sleep, dehydration, hormonal changes, especially in women during menstruation or pregnancy, bright lights, strong smells, and even certain foods like aged cheese, chocolate, caffeine, or processed meats containing nitrates. Skipping meals and irregular sleep patterns can also ignite that storm inside your head. For some, even weather changes or strong emotions can trigger a migraine attack. Next, let's understand the symptoms, because they're what make migraines so unique and often so disabling. A typical migraine can last anywhere from 4 hours to 3 days. The pain usually feels like a deep pulsing or pounding on one side of the head, but that's not all. Many people experience nausea, vomiting, dizziness, and an extreme sensitivity to light, sound, or smell. Some people see flashing lights, zigzag lines, or even temporary blind spots before the headache begins. This phase is called an aura. Others feel warning signs hours before the attack: fatigue, mood changes, or difficulty concentrating. These signs are your brain's way of saying something is coming. Recognizing them early can make a huge difference. Now let's move toward the treatment options, because the good news is migraines can be managed effectively. Treatment usually falls into two main categories: acute treatment to stop the attack once it starts, and preventive treatment to reduce how often and how severe migraines become. For acute relief, doctors often recommend medications like triptans, NSAIDs, or acetaminophen to stop pain early. For those who experience nausea, antiemetic drugs can help, but here's the key: the earlier you take these medicines when symptoms begin, the more effective they are. Waiting too long can reduce their impact. For prevention, lifestyle changes are just as important as medication. Keeping a migraine diary to track your triggers is a powerful step. Managing stress through meditation, yoga, or deep breathing. Getting consistent sleep, staying hydrated, and eating balanced meals on time can dramatically reduce attacks. Doctors may prescribe beta blockers, antidepressants, anti-seizure medications, or newer options like CGRP inhibitors, a modern class of migraine-preventing drugs that target the specific molecules involved in pain signaling. Another promising therapy is Botox injections, approved for chronic migraines. It may sound surprising, but small doses of Botox help relax the muscles and nerves that trigger migraine pain, offering relief that can last for months. But beyond all the medical facts, here's something crucial: understanding and empathy. Migraines are invisible, but they are real and powerful. Many people silently suffer because others don't see their pain. So if you or someone you know experiences migraines, treat it seriously. Get medical help. Don't just pop painkillers and hope it goes away. The earlier you understand your triggers and get proper treatment, the faster you regain control over your life. Migraines may not be curable yet, but they are manageable. With awareness, healthy routines, and the right medical guidance, you can significantly reduce their power. So the next time you feel that warning, tingle, or pressure in your head, don't ignore it. Listen to your body. Take a break. Stay hydrated. Protect your peace of mind. Because your brain isn't your enemy, it's just asking for balance. Remember, healing begins with understanding. Migraines are not a weakness, are a signal. Learn the signal, manage it, and take back your life, one mindful step at a time.